Welcome, everyone. Thank you for joining us this evening in a very important webinar to talk a little bit about what's going on with competitive bidding and catheters and how it can impact you and what you can do about it. With me today is Julie Allen from Powers Law Firm. Powers is a law firm here in the DC area that works on disability health issues and works very closely with SBA and other organizations and has been working diligently on this topic. So I'd like to introduce Julie Allen and let her get started.
Great. Good evening, everyone, and thank you so much for joining us and taking time out of your evening to be part of this discussion and to allow us a chance to collaborate and work together on how we can tackle the latest challenge that Sarah's highlighted here in terms of addressing a proposal that has newly come out of the administration and thinking about the tactics we can use together to ensure that policymakers appreciate and understand what such a change would mean, whether you're a clinician or a patient, an individual who's long had spina bifida and has a lot to say about this particular issue. So with that, we can start to advance and go to the next slide. Great. All right, so we don't have a lot of time tonight, but we did want to go over a little bit of history and help you appreciate and understand what is competitive bidding. What does it mean when we talk about this issue in terms of its impact on Medicare beneficiaries. We want to spend some time strategizing and talking about why catheters are different. So if we're talking about competitive bidding in relation to catheters, what do lawmakers need to understand that you know all too well, but they may not have a clue or understand anything about catheters and how they operate and why they need to be thought of differently. We want to talk about things like risks to patient health. So again, they can appreciate and understand the dynamics at play here. I want to spend a little bit of time talking about the current policy landscape and some strategies for what we can do together to take action, and then of course have some time for questions and answers. And next slide. All right, so getting into a bit of a competitive bidding 101. And some of you are very familiar with this topic. This isn't the first time we've had a discussion about competitive bidding possibly having an impact as it relates to things like urologicals or ostomy supplies or tracheostomy supplies. This has come up through the years, so I just want to give everybody a little bit of a refresher on what this program's all about, what its goals are, and the history tied to our immediate interests of concern. So the Medicare competitive bidding program, what it does in a nutshell is set payment rates for certain durable medical equipment and supplies. And it does that through a bidding process with suppliers. Again, this is specific to the Medicare program itself. Medicare has long defined the categories of products that are eligible to be bid in this way and has also talked about the bidding areas in terms of who can bid on these types of contracts, where those locations would be. Suppliers submit bids and they have to follow very strict rules in terms of what they can include in their bids and whether or not they'd be eligible to do so. And then Medicare will select winning bids and set payments for those products, replacing the historic fee schedule rates for those. And this is a program that is meant to really reduce overall pricing for the products that are bid. So there are significantly reduced rates from what these products had been typically reimbursed at. The competitive bidding program actually began in 2011. There were a couple different rounds that were set that had very specific defined terms. And the products that were eligible for inclusion in the past were things like oxygen equipment and supplies, standard and power wheelchairs, walkers, hospital beds, CPAP machines, enteral equipment and supplies, things of that sort. Also diabetic testing supplies. The program was actually put on hold in January of 2024. And since that time, the products that had been eligible under the first round of contracts has since expired. And there has been, a lot of quiet about this program in the years since. We have not heard as much about competitive bidding since the program was put on hold. And there was an open question as to whether the Trump administration, once they took the White House, would reconsider implementing competitive bidding and how they may go about doing that. When we talk about the goals of that program, it is what it seems. It's to save overall dollars for the Medicare program. So as we get into a bigger discussion here about the proposal that's underway, we need to really consider that dynamic. If the goal is to save money, how can we emphasize that inclusion of supplies and products that should not be in this program does not accomplish the goal? It would not save money. Okay, next slide. All right, again, we talked a little bit about this, but just to give you a flow chart in terms of how the process does work for competitive bidding. CMS sets bid categories. We talked about the products that have been eligible through statute and through regulation. Suppliers submit their lowest price offers. CMS awards contracts to those lowest bidders. And only those who are contracted, so the bids that are selected by CMS, can provide the supplies that they have been awarded to make available. And ultimately, what this means is that patients lose choice. They only have access to the products that the selected supplier can provide. Next slide. So what is on the agenda today in terms of what the administration has proposed? The administration is saying that they want to include urologicals, that includes catheters, ostomy supplies, and tracheostomy supplies in a future round of competitive bidding. And that is all they have said about this at this point. But that is their intent. We do know that there are individuals who are in the Trump administration. There are folks at the Office of Management and Budget who have brought this issue up many times in the past. And our understanding is that they are strongly advocating for the inclusion this time around. And we'll talk a little bit about the federal process and what that looks like for when this could go into effect and what the consideration and timing looks like. So what we want to spend some time with talking to you all about is how we push back effectively on the inclusion of catheters in any urologicals in the competitive bidding program. And as you all more than understand, catheters are not one size fits all. Right, there are many different types of catheters. Sarah has outlined here 1,300 different catheters with many different types for different purposes. So we have hydrophilic, non-hydrophilic, different sizes, different tips, and selection of which catheter is appropriate to an individual is based on that clinician's engagement with an individual to support their needs. Clinician guidance is critical to ensuring that individuals have access to the catheters they need to support their health and well-being. Next slide. Oops, I think we missed one. There we go. All right, so that's the why and the rationale as to why. But talking about why product matters, we want to think about how do we get this message across to a policymaker who has had no experience whatsoever with use of a catheter or a loved one having experience with this. So you want to help them appreciate and understand, what are the consequences if a product does not work well for an individual. So when we're talking about competitive bidding, if someone only has access to a generic catheter that won the as part of the supply contract under competitive bidding that has is totally inappropriate for their own health and well-being. Why is that a problem? Why does product matter? And we're kind of bucketing this into three major areas. The wrong catheter equals serious complications. We'll talk about medical complications and what this means for someone's health. Specifically, the risks are such consequences as significant UTIs, kidney damage, extensive hospitalization because someone didn't have access to be able to manage their health in the way that they need to. And that all of this is preventable if individuals have access to the catheter that they need to manage their health and well-being. Next slide. I can't emphasize enough to you all that real world patient stories are critical at a time like this. You know, policymakers, whether we're talking about folks in the administration or individual members of Congress, are thinking about an issue like this strictly from a dollars and cents standpoint, and one that they have misconstrued in their own mind. So they're thinking about, how do we have savings? If you read the headlines lately, everything is about how do we address fraud and abuse, right? And it's about driving down cost, shrinking programs, managing dollars. It's not about you. It's not about, what kind of implications would a major policy reform like this have on someone's life? What would it mean for clinicians who are trying to manage their patients? Those thoughts are out of sight, out of mind. And it's our job to make sure that we put those first and foremost, and we make those lawmakers sit back and think about this in terms of, what might this mean for my constituents? And we need to be dogged in that effort so that they hear from us, that they hear this repeatedly, that they understand, and they can get this from a human perspective in terms of the impact such a policy reform would have. So when we think about this and how to advocate, real world patient stories are paramount. We need to practice that. We need to be, and this community is, there's no community better than this community in terms of the practice that you've had for Teal on the Hill and other efforts when you advocate before members of Congress. You know how to take your story, which is not short and succinct, but passionate and important, and really come up with a short, impactful example of what could happen or what possibly has happened when you haven't been able to have access to the supplies and the care that you've needed to have. Personalizing this issue so it's not just a matter of dollars and cents on the spreadsheet is going to be critical for us to be successful this time around. Next slide, please. All right, so we talked a lot about the mechanics behind competitive bidding. Really, when we want to boil it down in terms of what problems does it present, what is the impact of this on patients who have spina bifida for the clinicians who are trying to manage their patients. This is about reduced supplier choice. So under the program, you would not have access to the supplier or necessarily to the supplier you rely on today. You wouldn't have any choice. You would be told this is what's available for you, and it would be provided to you and not treated as the prosthetic that it is. There would be loss of access to preferred products because, of course, you have your reduced supplier choice. There are potentially higher out-of-pocket costs because if there are health complications that result from you not having access to the product that you need, there could be extensive health complications and higher costs for you and to the overall healthcare system. And there could be significant delays in receiving your supplies because we don't know where this bidder is located that wins the bid. We don't yet know, with the changes the administration has suggested, exactly how supplies will be made available to anyone on a timely basis and what that looks like. So the delays because of access issues, geographic location, and otherwise are very real. Next slide. All right. So, in further getting into some more explicit details of what the problems are with the competitive bidding of urologicals, again, we're treating catheters under that program as interchangeable products. They're not considered in any way in terms of their clinical attributes. That doesn't calculate into the bidding process whatsoever. They increase the risk of medical complications, as we've talked about, significantly disrupt established care because the clinician and the patient choice and the decision-making process that exists today would not exist because the government would be deciding what is made available to each individual. It would no longer be a choice that's made between the clinician and the patient. It creates a threat to independence and quality of life. Obviously, this has significant risk as it relates to anyone with a disability who relies on catheters, because if you can't have access to the product that supports your health and well-being, ability to work, ability to be out in public, ability to do any of the activities of daily living, this creates immense risk to an individual's rights. We've talked before about this not likely saving money, and that's an important point. I know that's one that we're really going to drill down on in DC. We're talking about inexpensive products already. So if we're going to then create dynamics that increase overall costs for individuals, we're not saving any money. And we want to talk about this in terms of harm. I think there are lots of words we need to think about when we talk about this, and harm is real here and not something that is an exaggeration whatsoever. Okay, next slide. All right, so when we look at the current policy landscape, just to give folks a sense of, what is the timing associated with this change, where do we sit in that process? The administration put forward a proposal. They do this, they have a series of regulations they put forward every year that deal with payment systems across the overall Medicare system. And they included this proposal inside one of those proposed regulations, issuing it on June 30th of this year. And again, that being the inclusion of catheters in the competitive bidding program at a date to be determined. The comment period is open for stakeholder feedback. It's open now, and that process closes on August 29th. This administration's given a very short comment period on their overall proposal that they released, and this is one aspect of that. But this is the time period that is allowed for any stakeholder. You don't have to be part of a lead organization. You can do this on your own as well, to issue comments in response to the proposals that were included in what was released in June. And then what the administration does is take all of those comments, they read through them, and they issue a response that's in the form of a final rule that comes out typically around November 1st. Could be a little bit later in November, but that's the time period in which a final rule would be released that would include a decision on what they intend to do around the inclusion of urologicals in competitive bidding. Next slide. Okay, so there are numerous efforts underway. The Spina Bifida Association has taken no time to rest on this one. It's all systems go in terms of building coalitions and advancing efforts to ensure that we are pushing back effectively on this proposal, and that we are active in the policy period where the agency can hear comments on this, and that we are even going above and beyond that in terms of our engagement with Congress and those who can have influence over this process. So there is a significant coalition activity underway that includes SBA, The catheter companies, so the major manufacturers in the space, are engaged as part of that effort, as well as significant patient and disability coalitions, including the ITEM Coalition that many of you are familiar with, and in partnership with AA Home Care. And we're all working together to have a robust strategy in a very defined short window of time to push back. Next slide. All right, so I think many of you have questions about how do we take action? You know, what is the time period that we have to work with? Is it just the comment period, or is it beyond that? And we're working to make that as easy as possible because we want every one of you to engage as part of this effort. So the first step in the process, given the time period that I just outlined, is to send a letter to CMS specific to opposing the inclusion of catheters and any urological in the competitive bidding program. And then to submit that letter to CMS. Again, that's the one with the hard deadline of August 29th. All right. And we can talk a little bit about that in the Q&A and what that process looks like. We want you to share your story with SBA so that we have patient examples to bring forward when we're on the Hill and we're sharing with members of Congress some compelling anecdotes of why the inclusion of urologicals in competitive bidding would be so dire for patient health and well-being and for the Medicare program. So that's another timely ask of you, that you share those examples, those stories that really can hit home. We want to help all of you to reach out to your members of Congress, whether you're a clinician or you're an individual who wants to get involved and have your voice heard. We want to make it very easy for you to engage your member of Congress, both your House representative and your senators. We've put together a letter that will go up on SBA's grassroots system. Like you've utilized before, as simple as putting in your address with your zip code. It auto connects you to your member and your senators. And the letter will be self-populated right there. So it allows you to just hit send. So we can have a compelling letter go up and have a lot of volume in terms of the noise that we make on the Hill. We also want to use social media effectively. You know, I think I've sometimes still pinch myself on this one, but many times members of Congress go to social media more than they do even the letters that are coming in. When you tag a member of Congress with, you know, we really need your action on this. You know, we can't believe that there be any support for this. They're going to take notice. They're going to see your message. They're going to have their team respond to you on that, and those types of messages start to spread like wildfire. So we really, and you know, as we have members of Congress speak out on this, we want to give them credit too. We want to make sure that we are keeping the noise level alive on this until we know that the fight is over and a decision is made to not include these products in the competitive bidding program. I won't get into all the tiers and layers of how the Hill works on an issue like this too, but from my standpoint, the first fight will be over when we have success in November. And then we want to make sure that members of Congress don't individually support this idea to try to do anything through legislation. So we're going to be pushing through this year to make sure that we have clarity both on the Hill and within the administration, that these are not products that should be included in the program ever. All right, next slide. So just to summarize, we want you all to have the talking points you need to be successful, and we've built out those tools. A template will be provided to help support your efforts, whether you're writing a letter to CMS so that you're on the record in terms of your position on their proposal. The SBA Public Policy Committee is actively involved in this issue and strategizing, again, working in coalition partnership. The advocacy portal will be set up with the grassroots message that I mentioned, so that it's as easy as pushing, you know, putting in your address and information and pushing send to help you get messages up to the Hill um, immediately. And self-advocacy, again, you have organizations that are pushing for this, this being the opposition of this proposal. And we want to make sure that you are always able to advocate for yourself and your family's needs, and have the tools that you need to do that and address a concern like this.
So there have been some questions that have come in,
Great.
and so I thought we could address some of those, Julie. And before we get
Sure, I
started,
saw a whole bunch popping up.
yep. Before we get started on that, I do want to assure everyone that we have drafted. First of all, you'll get access to the PowerPoint, so don't worry. We've also drafted talking points for you so that you can consider those when you're writing your letter to CMS. Which, Julie, what does CMS stand for again?
It's the Centers for Medicare and Medicaid Services. So us in Washington tend to talk in too many acronyms, so
Right.
apologies
Uh,
for making an assumption on that one.
that's okay. And so you'll get a letter template that you can use as a guide to help you to write a letter, to make comments about this to CMS. The Public Policy Committee has actually volunteered. If you're stuck and you need help writing, we can get you in touch with a volunteer who can help you to write your story so that you can write your comments. We'll get our CiviClick up and running so that you can access the letter. And please don't hesitate to reach out if you have any other questions. So let's get started with some of the questions. And unfortunately, there were some comments made, and I want to agree that there's no way that we can guarantee no cross contamination or no latex in this kind of a system because it will be based solely on the cheapest products, and that's it. Um, and as far as why CMS doesn't pay for compounded meds to help with UTIs, I have no idea, other than they're trying to cut back on everything, so they're not going to expand services that easily at this point in time. Although it's kind of a bit like cutting your nose off to spite your face, but it is what it is at this point. Does this affect Medicare Advantage insurance programs?
So no, this is strictly within the Medicare program. The Medicare Advantage contracts get to select the suppliers that they work with as part of their contract agreements.
Okay. Um,
Just one point on that too. The problem here, and we see this across Medicare, when Medicare makes a drastic change, other insurers can follow.
yeah.
So while this doesn't have the immediate effect of, having full bearing on Medicare Advantage where they need to follow that, they do watch and they see. And if you see something reduced in its product cost significantly, then they very well could follow suit.
Well, and I think that also, when we talk about 1,300 different kinds of catheters, if Medicare is only paying for 7 different kinds, let's say, and then what's going to happen to the industry that supports the development of those catheters and the manufacturing? They won't exist anymore because they'll go out of business. Because if you can't get them covered, people can't afford them out of pocket. So as a result, it will wind up forcing companies out of business as well too. So it's not just about the health of our people, it's also about the health of that economy and the supply and the future for people as well, I think. So yeah, it's going to have an impact one way or the other if this goes through.
Yeah, it certainly could reduce the number of manufacturers overall. We've certainly seen that play out with other
Yep.
products under the competitive bidding program. And also it has a dampening impact on research and development for improved products.
Right.
Because if you know where you're going to be paid and it's, sort of basement bottom clearance rates, why would you invest in more R&D to improve upon a product category?
Right. And yes, this does impact other equipment. First of all, it's kind of like the canary in the coal mine. If they get this through, there will be other, they will try it for other products. But currently, it's urologics, it's ostomy supplies, and trach supplies that are being considered in this particular rule. So, not a lot of our individuals in our community use ostomies. However, some people or have ostomies. However, some people do, so it may have some impact on them. Please feel free to include that in a letter if it does impact you, so that you can point to not only the catheters but also to the supplies that you need to maintain your ostomy safely. Um, and no, this is not at this point in time Medicaid related. It is Medicare, but again, as Julie said, where Medicare goes, everybody else soon follows. So if they feel like they're successful with this, they'll try applying it to other programs as well, I'm sure. All right. We also received several questions in advance, and I want to see if I can ask some of the questions and see if we can answer them for people. One of them was, how can others get involved to advocate and speak out against the proposed CMS rule?
So we certainly want everyone and anyone to reach out and oppose this. We have put together some tools to capture different audiences so we can make it easy for folks to partner together. There was another webinar held yesterday that was open to all ITEM coalition members, but there are other advocacy groups that have raised a lot of questions and wanted to support the ITEM Coalition's activities. So we've invited them to join a larger letter of patient groups and disability groups in particular, so that we are speaking with one collective voice. I certainly encourage all of you to talk to others about this. If you're in the clinician community, call on your colleagues to get involved. Share with them the information that you're attaining from SBA and encourage them to draft similar letters. If folks have questions, you can navigate them to Sarah or myself so that we can help to provide access to the information that's already been developed. We're certainly doing all we can to put templates together to make it very easy for folks to submit a comment letter. That's not a process that most folks know about or understand. So we want to make that as simple as possible. We encourage you, if you're active in social media and you have a good network, put information out, put links to information where others can grab onto that so that they have information to work with.
I think the other thing too is if you speak with your physician, make sure your physician is aware of it. See if maybe they'll speak out as well too.
Yeah, that would be fantastic.
It looks like most of the questions, most
There-
were comments and not questions. Um,
so,
but
I'm sorry, Sarah, there was a question. I've seen a couple questions about how this might impact people with private insurance.
yeah, that was, we had addressed that a little while ago. Again, where Medicare goes, private insurance usually follows. So while it may not have an immediate effect on insurance, it can have an impact on insurance down the road. It definitely will have an impact on the supply of catheters, though. And so we already know that catheter companies are starting to cut back on the number of catheters. I think I read somebody's comment in one of the comments that were sent earlier to us, and they said that they get paid for 35 catheters a month. Well, yeah, most people go to the bathroom a lot more than 35 times in a month. So I think we're seeing more and more of kind of like the restrictions of these kind of supplies on people. And these are the supplies that ensure that people stay healthy, because you can't go to the bathroom any other way. I mean, this is literally your bladder doesn't function if you have spina bifida and it impacts your bladder. And you have to have a catheter in order to go to the bathroom. And so it is a prosthetic device. So the thought of it being treated like toothbrushes is just asinine. So the more we speak up about it, the louder we get. If you are a social media influencer, if you can amplify this, please do so. If you have connections with the media locally, get the media to talk about it. I mean, write letters to write op-ed letters and letters to the editors about this. People need to know this kind of stuff is going on. And, the way I look at it is people shouldn't have to pay to pee. And that's exactly what they're expecting us to do. So, we've got to be vocal, we've got to be decisive, and we've got to keep beating the drum because if we don't, this surely will go through.
Yeah, this is a policy reform that is buried in a rather large regulation, so it hasn't really seen the light of day, and that's our job, right? All of us working together to make sure that we're talking about this, we're talking about it a lot. I mentioned before that this issue has come up. So this threat's come up in the past through different forms of proposals, whether it was out of the administration or by policymakers on the Hill, to say, oh, is there money to be made here? Are these simple supplies that can just be shipped to folks and not have any consequences other than potentially saving the program dollars. And the only way we've successfully defeated this over and over again is with your voice.
Mm-hmm.
Folks on the Hill want to understand how much pain are we going to face if we implement this kind of policy reform? Are we going to hear from anybody? And it's very easy to push forward reforms that are harmful when they don't hear anything,
Yeah.
right? So we have to hold them accountable. We have to make it real when we talk about your real life experience and all of what Sarah was just saying. They need to understand that. This is what this policy would mean for me and how I
Right.
function on a daily basis. And we need those examples and those messages to be that explicit and put right in front of them.
Um, so, John, I saw that you asked a question about AUA. We have reached out to AUA. If you or anyone who is a urologist can encourage them to get off the stick about this, I'd really appreciate it because it's been stuck in their um, hierarchy. I don't know how else to put it for a while now. So, any help that urologists can help to get them to also weigh in on this, I think would be really helpful. Um,
Yeah. And your push for that could have
and
huge
so we
influence.
just got a question about if you will receive support materials to assist with this. Yes, you will. They should go out probably tomorrow or the next day. But you don't have to wait to start thinking about what your letter's going to include, because I think you can probably write your story right now about what it means to you if you lose access to the catheters that you need. But yeah, we'll get it out either tomorrow or the next day so that you'll have access to the PowerPoint, to the talking points, and to the sample letter that you can use as a guide, as well as the instructions of how to go in and put your comments into CMS. Thanks, John. I appreciate it. If you reach out to that guy, that'd be great.
John, you did mention too, we do have members of Congress who are urologists, right? So SBA and other partners have reached out to them. There have already been discussions with their offices about the necessity of their personal weigh-in on this issue, and we are working through that. They have also asked for talking points for their engagement with the administration. So we're following through on those issues, on those efforts.
Unfortunately, you're so right about clinics shutting down. It makes it harder to get the word out. I don't see any other questions. Does anybody else have any? All right. Well, if not, then we can,
Right.
did we just get a new one? Oh,
Looks like a
that was,
thank you.
that was just a thank you.
Yeah, no, and thank you all for taking time again out of your day to have this discussion, to start thinking with us about how we can win this time around. And we're really grateful for any time you spend reaching out and really ensuring that folks understand this at a personal level. So thank you.
Yes, and thanks. Please reach out to everyone you can think of, urologists, other members of the community, using social media. Let's get the word out. Take time to write your letter. Stay tuned for our grassroots effort for Congress. So all of those things we'll be harassing everyone about, but we'll definitely harass you guys more so than others. And if you run into difficulty um, with writing your letter, need some help, let us know, and we'll get one of the members of the Public Policy Committee to work with you to do that. So there should be no reason people can't do this. So let's let's get our make sure the voices are heard. Give them hell, folks. They deserve it.
Let's win again.